Good afternoon, everyone. I am Dr. Sirisha. I am a consultant ophthalmologist at KIMS Sunshine Hospitals, Gachibowli. Today, I will be talking about a very important topic called age-related macular degeneration. Age-related macular degeneration is one of the most common causes of blindness in elderly patients above age 50 years. So, what is age-related macular degeneration? It is a progressive eye disease that affects the macula, the central part of the retina. The macula is responsible for the sharp central vision which we need for activities like reading, driving, and recognizing faces. Age-related macular degeneration develops. This central vision can become blurry, distorted, or even lost altogether. Generally, only the central vision gets affected. The peripheral vision does not get affected. There are two types of ARMD, which is dry ARMD. This is the most common type of age-related macular degeneration. It affects about 80 to 90% of the people who get ARMD. It occurs due to a gradual breakdown of the macula and the accumulation of tiny protein and fat deposits in the macula called drusen's. The other kind, which is more eye-threatening or vision-threatening, is called the wet ARMD. It is less common. Less than 10% of the patients with ARMD develop this, but it can cause rapid loss of vision and if it is not detected and treated on time. So in wet ARMD, what happens is abnormal blood vessels develop at the macula which damage the macula. So what are the common risk factors for age-related macular degeneration? The most significant obviously is, as the name suggests, is age-related macular degeneration. This commonly affects in people of the older age group, in their 50s and 60s and older people. There's a very high risk of ARMD in people who have family history of ARMD. So genetics play an important role. Other factors include lifestyle diseases, obesity, smoking, poor diet also contribute to age-related macular degeneration. Another cause can be prolonged UV exposure, and some other systemic diseases like blood pressure, heart diseases are also linked to increased risk of age-related macular degeneration. So what are the symptoms of age-related macular degeneration? Early symptoms, or rather in early stages of especially dry age-related macular degeneration, might not have any symptoms, but in wet ARMD or in advanced stages of dry age-related macular degeneration, the symptoms can include blurred or fuzzy central vision. Straight lines can appear wavy and difficulty in seeing fine lines, distorted vision, and sometimes dark or empty spots, which are also called scotoma, in the central field of vision. How is ARMD diagnosed? It is diagnosed in a routine clinical examination, which includes a vision test and a fundus examination or a retina examination, where your ophthalmologist will detect these drusen's or what we call CNVM in wet ARMD. So another way for you to detect at home is through the usage of something called the Amsler grid. So the Amsler grid is a grid of vertical and horizontal lines which you can observe at home, and you can observe there are different shapes, or you can observe the distortions in your vision when you see the Amsler grid. It can, these distortions which we had discussed earlier, like dark spots or wavy lines or irregular lines or some absent lines, can indicate that you are developing a macular degeneration, and you need to report to your ophthalmologist immediately. At your clinic, the ophthalmologist will do a fundus examination along with other examinations called OCT or optical coherence tonometry, and something called a fundus fluorescein angiography and fundus photos, which can give us an indication of how bad the disease is. For treatment, majority or for 90% of the time, there isn't much in way of treatment if you get the advanced disease, but for early diseases, prevention is better than cure. So prevention is by following a healthy lifestyle, which includes a healthy diet, which includes food rich in green leafy vegetables, omega-3 fatty acid rich foods, fresh fruits and vegetables, and nuts. If you are a smoker, quit smoking. And regular eye checkups are also very useful in detecting ARMD on time. UV protection for especially for those who have a lot of outdoor exposure, and control of sugar, blood sugars, and BP in case of systemic diseases. And sometimes your ophthalmologist can advise supplements which are eye specific vitamins and minerals, which help in slowing the progression of this age related macular degeneration. Lastly, in case of wet age related macular degeneration, where the macula is getting affected, sometimes you can use injections, something called vascular endothelial growth factor injection or anti-VEGF injections, which can stop the abnormal blood growth which causes this wet ARMD.